Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over the stages of wound healing. But first, if you could hit that like and subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. We have our 4 stages every wound goes through to heal. Now, sometimes a wound does get stuck in one of these stages. But these are the 4 stages it should go through. A healable wound will go through. Okay, so we have our homeostasis phase. This is the process when the wound is being closed by clotting. So we just cut ourselves, it starts bleeding, and it starts to form a little clot there. That's our homeostasis, so we don't just keep bleeding out. Our platelets do its job to stop the bleeding and prevent anything from entering. The inflammatory stage is the second stage, and this happens right after the injury. So this is when the blood vessels are leaking transudate, causing localized swelling. Okay, so it's causing localized swelling to the tissue surrounding the wound. The proliferation phase is when the wound is starting to be rebuilt up of collagen and extracellular matrix. So how I personally like to look at this is like just a mound of bricks. So they're trying so hard, your body's trying just to get it to close. So it's just throwing the collagen and extracellular matrix all into a pile, get it closed as quickly as possible, prevent any infections, prevent any bugs from getting in there. We want it closed super quick. They just work super hard, just throwing it all there, okay? Then in our maturation phase is kind of our remodeling stage. So you can see here is that's when we're going to make it pretty tissue. Okay, so our maturation stage is when they're going to remodel and make it perfect, okay? Perfect like our normal skin. Now this normally starts at about day 21 of wound healing, and it can take upwards of a year to get the wound completely healed. Okay, so this goes for any wound. It takes up to a year. So if we have damage in that same area, say it's a pressure ulcer, for up to a year, it's at high risk of being re-damaged, okay? Because we don't have this perfect tissue until a year later, okay? That's why we get reoccurrent pressure ulcers, especially on the bum, if we're not changing anything. So if we're not getting, say, a rojo for them to sit on, it can be damaged so easily, okay? So that's a big reason why we have reoccurrent issues. I hope you did find that helpful for your daily practice, and I will catch you all in my next video. See you guys.